This video will help you understand retinoblastoma, a type of pediatric cancer that arises from the eye. You will learn how retinoblastoma forms, its signs and symptoms, how it is diagnosed, and how it is treated. What is retinoblastoma? In retinoblastoma, cancer develops at the back of the eye in a structure called the retina. The retina is covered with special cells that sense light and color. Retinoblastoma is rare. It makes up about 3% of childhood cancers. Retinoblastoma most often occurs in babies and young children, usually before the age of 3. It rarely affects children older than 5 years old. Retinoblastoma can affect one eye or both eyes. When one eye is affected, it is called unilateral retinoblastoma. When both eyes are affected, it is called bilateral retinoblastoma. Most cases of retinoblastoma are unilateral. Bilateral retinoblastoma is less common than unilateral, affecting about 40% of patients with retinoblastoma. Some types of retinoblastoma can be hereditary, which means passed down through families through a gene change or mutation. Children who have hereditary retinoblastoma are more likely to develop other cancers later in life. However, most often retinoblastoma is not inherited. Because retinoblastoma is found only in very young children, parents or caregivers are often the first to notice that something seems different about their child's eyes, or perhaps their eyes look different in photographs. The most common sign of retinoblastoma is a white glow in the pupil in a photograph. The pupil is the black center part of the eye. In a child with retinoblastoma, a camera flash can cause a white pupil reflex known as cat's eye or leukocoria. Retinoblastoma can also cause a lazy eye, where one eye may turn outward or inward when the child looks straight ahead. This is also known as strabismus. Other symptoms of retinoblastoma include vision problems, eye redness or irritation, and eye pain caused by added pressure as the tumor grows. This may also cause nausea and vomiting. Signs and symptoms of retinoblastoma overlap with many common eye diseases and disorders, so it is important to have a children's eye doctor do an eye exam and other tests to make a diagnosis. A doctor who specializes in treating eye problems in children is called a pediatric ophthalmologist. Some ophthalmologists are trained to treat eye cancers. These specialists are called ocular oncologists. To diagnose retinoblastoma, doctors perform a detailed eye exam under anesthesia. General anesthesia causes a complete loss of consciousness, like a deep sleep. A doctor looks closely at the eye with a strong magnifying lens and a bright light. A special camera takes digital pictures of the eye. By looking closely at the eye and images, the doctor can see if there is a tumor. Doctors can also look at the tumor size and location to help plan treatments. Other tests that can help diagnose retinoblastoma include a physical exam and health history, blood tests, and imaging tests such as ultrasound or magnetic resonance imaging to see if the cancer has spread. Unlike with some other cancers, a biopsy is not used to diagnose retinoblastoma. This is because a biopsy could cause cancer cells to break off and spread. Doctors plan treatments for retinoblastoma based on the stage and risk level of the cancer. They will consider questions such as how big is the tumor, where is the tumor located in the eye, and has the cancer spread outside the eye. Early detection is important. When retinoblastoma is diagnosed and treated early, there is a good chance of cure. If retinoblastoma is not treated, it can spread throughout the eye or eye fluid and then outside of the eye into nearby tissue. Retinoblastoma can even spread to the brain and other parts of the body. In some cases, larger retinoblastoma tumors break into smaller tumors. This is known as seeding and makes the disease harder to treat. Treatment plans are designed to meet each patient's unique needs. Treatment will depend on whether the tumor affects one eye or both eyes, the extent of the disease, and if the tumor has spread. The care team will also consider the patient's age, family history, and genetics, whether the tumor affects the center of vision, and if the tumor has broken apart. Treatment plans can also depend on where the patient receives care and if they are part of a clinical trial. In some countries, certain tests and treatments may not be available. Chemotherapy is a treatment option that includes one or more strong medicines designed to kill cancer cells or stop them from growing. Chemo for retinoblastoma might be given through a vein by IV, into the fluid of the eye, or into an artery of the eye. Chemotherapy alone cannot cure retinoblastoma. This is why it is used along with other treatments. Focal therapy uses a laser or extreme cold in a focused beam to target and kill the cancer cells. For some retinoblastomas, it may be the only treatment needed. Radiation therapy uses high-energy rays to kill cancer cells. A type of radiation therapy called brachytherapy is sometimes used to treat retinoblastoma. It uses a small radioactive device to directly treat the tumor. Very rarely, external beam radiation therapy may be used. In some cases, surgery to remove the affected eye may be needed to treat retinoblastoma. This surgery is called enucleation. Through surgery, it is possible to physically remove the cancer. For patients with unilateral retinoblastoma who have the surgery, removal of the eye is often the only treatment needed. After the surgery, the patient can be fitted for an artificial or prosthetic eye. A prosthetic eye is custom-made for the patient and is adjusted as the child grows so that it looks and feels as natural as possible. Children will have eye exams under anesthesia and cancer screenings for a period after treatment so that any recurrence can be caught early. Lifelong care for eye health, including routine eye exams, is important for all retinoblastoma survivors. Wearing protective glasses can help prevent eye injury. Patients with reduced vision may need prescription lenses or other vision assistance. Cancer survivors and families can work with their care team to develop a care plan to meet their specific needs. A diagnosis of retinoblastoma can be overwhelming. Every family has a different journey, but you are not alone. Now that you understand the basics of retinoblastoma, look around the Together by St. Jude online resource for more in-depth information and answers to your cancer questions. And please remember, we are here to help you face childhood and adolescent cancer together.